I want to bring in our next guest. We have Dr. Jennifer Pena, the former White House medical unit physician during the Obama administration, also the physician for Vice President Pence. Dr. Pena, thank you so much for joining us.
Thank you, Julia.
I would like to get your reaction to Anjali Khemlani's report there around the drug Remdesivir and what you're hearing as it relates to the pricing. Is that something that you would have expected?
Yeah, it's great news. Obviously, number one, that it's being distributed readily to patients that could get the most benefit from it. Of course, hospitalized patients that might have an otherwise protracted course of the condition. This drug, as we know now, has the ability to reduce the duration of disease in these patients. And so that's always promising. I'm at the hospital setting right now, inpatient setting, and I see it used relatively frequently. And it's just beneficial to see that this is going to continue. Obviously, in terms of pricing, something that we always worry about. As we know, this condition has disproportionately affected certain communities that have lower incomes, as well as less access to care, a lot of uninsured people. And so it's always concerning as to how these folks are going to be able to afford this medication that could really confer them significant benefit. So as a provider, that's always my biggest concern. Can we make it affordable so that the people who need it the most can get access to it?
Yeah, I appreciate you bringing that up. That's a good point around some of the inequities that have certainly been highlighted by the COVID-19 crisis. I do want to turn to what's happening in parts of the United States, specifically some of the southeastern states, seeing a rise in cases, and of course, states having to reverse some of their reopenings. What do you make of what's been going on?
Right. So it's extremely concerning, this issue that's occurring in a lot of the southern states, places like Florida, Arizona, and Texas. I think this weekend alone, just on every weekend day in Florida, we were seeing upwards of 9,000 new cases. And these are not relative numbers, right? These are true new cases, people who are actually coming into the hospital to get care. So it's not necessarily a factor only of increase in testing capability, but also these are people who are getting sick enough to end up in the hospital. And so another concern is also that it's a lot of young people that are being affected, people in their 20s and 30s. The concern there being a lot of these folks are asymptomatic, but they're going out and about into public settings, bars, beaches, et cetera, not utilizing the mask for protection of spread of the condition. And they're bringing that home to people that might be family members, for example, that are more vulnerable, the elderly and people with other conditions. And so, now, of course, you're seeing some of these states halting back their reopening plans, taking a step back. And there's some other of these states that aren't even planning to do another round of lockdowns yet. So that's extremely concerning. Are we going to continue to see even more of a rise in these numbers? And so, these three states I mentioned, right, Texas, Arizona, Florida, were among the three of the states that lifted the orders at the very beginning, right, when cases were still climbing. And so as Dr. Fauci mentioned, what happens in one state also can affect others. We need to be very conscientious about interstate travel. We cannot operate in a vacuum. And that's why you're seeing some of the states like New York, New Jersey, Connecticut, starting those travel advisories and these bans and making people quarantine if they're coming from states with high numbers of cases.
Yeah, Dr. Pena, you just brought up a lot of great points. The young people who could be spreading it, the lack of use of masks, and also the interstate travel. Does it make you more concerned, because we're still in the first wave? If we get that second wave, does that make you even more concerned about what that could look like? If people aren't taking it seriously now, what do you think? Do you think they take it seriously down the road?
Absolutely. And Julia, thank you for saying that we're still on that first wave, because that's absolutely true. There's this thought process that somehow we're past that first wave and waiting for that second hit. No, we're still very much on that first one, right? And so the concern is, there's that paradigm shift, because you have these young people who may be asymptomatic, 20 to 40% of them getting this, infecting more in the community setting. And these outbreaks are going to continue to go up. And as Dr. Fauci mentioned last week, we have to aim for this concept of herd immunity, right? Herd immunity, when you have a significant, more than 50% of the population who are immune to the condition, either via vaccination, which we still don't have, or via previous infection. And that's really what's going to help us be able to move past this, is aiming for that herd immunity. But in addition to testing, which is going to be important to identify who has been infected, and that's both antigen and serology antibody testing for convalescence, vaccination is going to be important. And right now, we're already hearing of patients who are concerned about getting vaccinated because they don't know what the effectiveness is going to be. They're concerned about potential side effects. And so it's really going to take an effort from us as medical providers to educate the community as to the importance of getting that immunity so that we can all collectively get out of this as a country.
Yeah, all really good points as well. And also, I want to go back to the issue around the mask and the mixed messaging we've seen from leadership in the country. We did see Vice President Mike Pence wear a mask over the weekend and then recently today, and also telling folks to wear masks. Is it too little too late on the mask side of the equation for people to, it's become so politicized. Do you think we need that messaging from up top?
It really has, unfortunately, become a political issue, and it should not be. It's a public health issue. Secretary Azar just made a recent statement out of concern for these rising numbers in the South, and also mentioned the need for this widespread use of masks and coverings. And no, it's not too little too late. It's never too late to start getting those precautions in place. And, you know, it's sad that it hasn't been made a federal mandate yet. And so it's still up to the states and individual businesses to mandate when they should wear masks. For example, here in Virginia, where I live, Julia, Governor Northam made a mandate. So anybody above the age of 10 who's out in retail and commercial spaces has to wear a mask. And that's great. And that's the kind of example that we need to continue to set. I'm very happy to have seen Vice President Pence wear his mask and set that example, because again, that example needs to come from the top. It should not be political. You wearing a mask should not matter on what side of the aisle you're on.
Dr. Jennifer Pena, thank you so much for joining us.
Thank you so much, Julia.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.